Thanks. Well, COVID numbers suddenly on the rise after a low threat level throughout the summer.
The number of people needing care in a hospital, that's also on the rise. The CDC says hospitalizations are up more than 20% this week, and it expects more. Bill Folsom is here with some perspective from local health leaders. Bill.
Yeah, they say any disease gaining momentum needs attention. This is also not the same as the pandemic. Instead, they say COVID now happens like flu and RSV. It recurs and requires caution. COVID numbers on the rise in Colorado. Back to school could be part of the reason.
Every year at the beginning of the school season, we start to see an increase in all kinds of different diseases, respiratory as well as other types.
The final bar on this graphic from Colorado Public Health shows a jump of nearly 1,000 reported positive cases in just 1 week. Also consider that the testing sites available during the pandemic have ended, so current numbers are likely underreported. This week's data also shows more people going to the hospital with severe COVID.
What we can say are we're seeing, an increase in people who are severely affected by that, who are either seeking care at a provider's office or are hospitalized with that disease.
Health leaders say it's not reason to panic. COVID has shifted from pandemic to endemic, which means like flu, RSV, and other recurring illnesses, it's expected. The ongoing challenge with COVID is, so far, its recurrence is less predictable.
What we're still trying to identify is the seasonality and the trend of that disease.
It appears a summer break from COVID is over.
Now we're starting to see those numbers starting to creep up. So it's enough for us to say, oh, something's happening, but not enough for us to, call out the guard and get really concerned as we have previously.
Keep in mind, this is data from 1 week. Numbers will be watched over the next couple of weeks to see if this is a trend requiring more attention. Of course, the best prevention is staying home if you're sick and using good hygiene etiquette. Mike?